Hi, everybody. My name is Dr. Jordan Talia. I'm an assistant professor here at Mount Sinai Dermatology, and I'm joined today by a patient who has been dealing with atopic dermatitis for many years, Malik. Malik, thank you so much for joining us today and your willingness to talk with everybody about what life has been like dealing with atopic dermatitis so that providers like myself and others interested can better learn from you what it's like to have the condition.
Thank you for having me. Thank you for having me. So my experience with atopic dermatitis day to day it's been a journey. It's been a journey. It's been part of me, part of my life. I've been dealing with atopic dermatitis for some years now, since I was like maybe 4 years old. So it's been a rough road. It's been a very rough road, very rocky.
And what specifically, for you, Malik, day to day, do you feel like it sort of, maybe impacts the quality of your life?
Yes, it impacts the way it makes me feel. Emotionally, for as far as like I said, all my life I've been hospitalized, for this condition, um, in all five boroughs. So I got familiar with the doctors and the dermatology clinics and things like that throughout New York City. I tried a lot of things. I try to stay sanitary as possible. Keep moisturizers in my pocket on the go. I be mindful what I eat, what I wash my clothing in, and things like that. What I touch. Um, so it's hard day-to-day basis because it's like almost living in a bubble. It's like you have to live in a bubble to survive and to stay with because any little thing you eat or anything you touch, you can flare up, you can break out. It's very sensitive. My skin is very, very, very sensitive. It's to the point I don't even like people touching me sometimes, honestly. Like I give you the fist pump. uh,
I really appreciate you sharing kind of the day to day. It certainly sounds like each day you have to be so mindful of everything about your condition, and it's something that's really always on your mind. And so I can imagine, that can definitely take a toll. And I guess, maybe more specifically, you touched on it, but can you talk about how it impacts you both physically and emotionally?
okay. Emotionally it impacts me because I'm I'm, I'm frustrated. you know, it's just like you don't feel yourself. You don't feel like you're full. You don't feel like you at your best self. I don't feel like I'm in my rare form. So emotionally, it makes it. I'm stressed sometimes behind it because not everybody understands the condition and what you're going through. It's easy to say don't scratch, but it's hard not to. It's almost like a crawling sensation. Physically, I'm worried about my parents all the time. As a young kid growing up, I was always called ashy, rashy, and things like that. So I was always teased. I had to deal with that growing up, but as kids, we don't really understand. We don't know, we're not taught. We don't understand. So certain things I did get, but then after a while, it takes a toll on you because then you have family then that don't understand. And it's like, don't scratch. No, you don't stop scratching. You can say that all day, but it's hard to ignore that feeling. And behind that feeling comes a lot of anxiety as well. It builds up anxiety, it builds up a lot of frustration and lack of confidence. Because you have to face the world with this condition. Then the first thing people look at is your external instead of internal, who you really are. So people focus and like, oh damn, what is that? What's that rash? Oh, you got reptile skin and things like that. So I've heard it all. I feel like I've been through it all. It's somewhat to just to be a testimony to this condition. I'm sure I'm not the only one with this severe condition. and sleepless nights and things like that. So it impacts me physically and emotionally. Is yeah, major.
I really appreciate you sharing that with all of us. Thinking about other ways we know that this can impact patients, but hearing personally from you, you talked about, for example, having been hospitalized, and I think more broadly, can you talk about how this disease has impacted you financially?
Financially, it's impacted me by prescriptions, overcharge for prescriptions, and then with the prescriptions that we're getting, the cost of the medication, and then the co-payment, the duration between having the medication and being able to get another refill doesn't meet the requirements of the condition because of how much you're using it and how fast you're using it. Especially with a person like myself, I maybe I try to moisturize 4 times a day, and I mean throughout the day. And that's what everything I'm doing. Like every time I wash my hands, I have to moisturize. So it's like with the prescriptions and the drugs, how can we bridge the gap between the providers and the insurance companies? Although when we know that may be a state legislation, piece, but how do we meet the requirements of the condition opposed to just the actual drug and what's needed? If that
That's
makes
a
sense.
fantastic point. The patient access is, a really important part of the actual medication itself. We can know the medication works, but we really have to make sure we can get it to the patient in a timely manner.
Right.
Um, Alongside the financial piece, how has it impacted, your ability to work? Have you find yourself having to take time off work?
So I found myself missing days of work, taking days off for appointments, um, calling out because I wasn't able to make it to work because of my condition, not able to get out of bed, feeling stiff, um, you know, just feeling down, like feeling not like myself, completely out of whack. So it's been many times when I lost a job because of my condition and things like that. And I was penalized because I had to call out so much and things like and be hospitalized so much. So because there wasn't a such thing as FMLA and ADA and all those things like that that I can use for disability. Um, although this is a disability, but me being a young guy, I like to be active. I want to be in the real world. I want to work. I want to meet people. I want to earn. So it's tough when I'm not able to do those things. Back in 2017, it took me almost a year to actually get back into working. I was in and out of the hospital for months. Montefiore, Mount Sinai, I was back and forth. So it took a toll on me, and not having a job. And a person like myself, I'm self-motivated. I like to do things. I like to, move around. Social capital is everything. So yeah, it hindered me. It hindered me. Yes.
Absolutely. I really appreciate you sharing that with us because I think it's such a testament about why having such an effective treatment is so important so that it's not the kind of thing that's going to take time away from your ability to keep and hold a job. Um, I think kind of along those lines of our ability to really understand, how this disease impacts you day to day. What are things that for you do you feel like healthcare workers that you would like for them to know, maybe that will allow them to offer more support and understanding in managing your condition?
Um, some I would like them to know that it can be a mental warfare. Um, Sometimes you might have to seek therapy, honestly. You know, um, More frequent follow-up visits and things like that, opposed to seeing a patient, on a Friday of the first week of a month and then seeing them 3 months late, through 90 days after. You know, um, because sometimes having a relationship is everything. When you feel comfortable with your doctor or the case may be, you feel as if like you're not just seeing me, okay, you did better than last time, or you doing worse than last time. Okay, maybe we should do this and do that. Let's actually sit and unpack and see what's not working and why it's not working and and how the patient is actually utilizing the drug and things. So I feel like if it was to gain a tighter relationship with the between the patient and the provider with the drug that's being prescribed is everything.
Another thing, I think in closing out, you've done really such a fantastic job, I think, of giving of all of us a sense of how it impacts you kind of more broadly, but then also, um, even from a day-to-day standpoint. And one thing I think that's helpful for us is we really try to understand the way that this can impact a patient. Are there any things you feel like as you've been through the healthcare system and you've seen providers for this condition that you think would be helpful that we didn't address for healthcare providers to be aware of in managing or just working with you with your condition?
Um, Honestly, I feel maybe more studies, more advocacy. To be honest with you, I would love to advocate for eczema. As a kid, I'm sorry to go left just a good little piece. As a kid, I always wanted to be a dermatologist because of my condition. Unfortunately, as my support system, it didn't work out like that for me, but I always stayed deep into it because it's with my experience, I can maybe help others. And I do. And some people ask me, hey, Malik, yo, what do you do? Hey, listen, don't take hot showers. Hey, man, do this. Hey, man, do that. Do certain things. So I am somewhat a walking testimony of this, condition. But I feel like maybe more studies, more conversations like this. Because sometimes you feel alone. Like seriously, like it's a lonely condition, and so many sleepless nights, crying and everything. Like I'll tell you, I've been through it all. I can't even. I mean, to the point where my mom used to tie my hands with socks so I won't itch as a kid, and it's like you scratch through it, because it's like you can't help it, and nobody understand unless you an actual physician and studying this work. It's a lot that comes with it, and I have a son now. Even with having a son, I was, worried about, oh, he's going to have eczema. I have to take care of now. I have to make sure I do the right things for him because of my condition. That was always my fear, not being accepted, So, yeah, it can, yeah.
Malik, I want to tell you, I really appreciate you being so open and giving all of us really a sense of what it has been like living with atopic dermatitis. And I want to let you know you've been such a really a tremendous advocate throughout this interview, and it certainly sounds like
Thank
you serve as such for individuals in your personal life as well. So
thank you.
we very much appreciate that, and I know everybody listening really appreciates
Thank you so
and
much.
can
Appreciate you.
better help them understand the disease. So thank you so much for your time today.
Thank you so much, sir. Thank you so much.